Good afternoon, Dr. Frankovich.
Hi.
We're here for the May 13th media availability, and I'll launch right in. Dr. Frankovich said Monday that the polymerase chain reaction tests used in the public health lab were very highly specific and highly sensitive. What is the percentage for specificity and sensitivity of the PCR tests used in the public health lab?
Well, it's a good question. It's a reverse transcriptase PCR test that we use. For this test, this was something that we are running the same testing that CDC has run. There is no specific published data on sensitivity and specificity, although there's certainly lots of studies looking at it, and it is, the studies support the sensitivity and specificity being in the high 90s, and that's about the best I can do without published numbers.
What guidance is the county providing for summer baseball leagues that are debating their future? And is it conceivable to have fanless baseball at some point this summer?
Well, I think that the logistics of team sports like this are twofold. One is fans, and one is just assembling the numbers of people needed to have teams, having them practicing together and interacting together over a period of time and multiple days. So I think some of those things are things that would be later and not earlier in this whole approach, and I can't really make an estimate right now. We're going to have to see where we are.
Okay, thank you. We received word from the North Coast SBA that the Humboldt County Office of Emergency Services will be releasing Phase 2 self-certification instructions for workplaces later today. Can you share more details?
Sure. Well, my understanding is that that is slated for today, so that'll be great news. I do want to point out that this isn't self-certification in the sense that someone might intend. What it is an ability for businesses to choose the sector that their business falls in, to look at all the guidance that we have right there for them on what's required, for them to put their plan into a template online and submit it. And then that plan will be reviewed, and then we will be able to get back to them about their certification.
Do you think Humboldt's soft reopening has played a role in the recent COVID-19 case spike?
I do not. We just started this, I think, last Friday, and I don't think that's had an impact on the number of cases we've had right now.
Do you believe the county is ready to move into the state's expanded stage 2? And what would that look like for Humboldt?
Well, I think, again, this is such a fluid situation. We prepared our report on this for the state, and we were using data for the 2nd, or May 2nd through the 8th, as they requested the prior week. We set that report up over the weekend. And of course, with the new onset of our cases, that changes the landscape a little bit. So we're going to be carefully watching what's going on with our caseload over the next few days. But we still submitted our report. The state's aware of our current situation in terms of cases, and we'll figure out, how to move forward based on what's happening.
Can you tell us generally if the patients hospitalized with COVID-19 locally were treated with remdesivir, and if so, did it appear to be successful?
Well, remdesivir is theoretically available to us here. You have to be on a protocol to use it, and we do have that capacity here in Humboldt County. I will tell people that remdesivir is in short supply right now. It is in very short supply, more so than it was at the outset. And so, it's going to be more difficult for us to access on a local level for treatment, as it is across the state, and I'm assuming across the country. But I can't speak to our particular experience with patients here at this time.
Thank you. According to the lab report, there have been 7 hospitalizations to date. Are you able to give us and the public a better idea of the severity of these cases we're not asking for personal information or anything that would compromise an individual's privacy, but have ventilators been used, have people been admitted to the ICU? And on the flip side, is there good news of patients being in a severe state but recovering?
So we have had individuals who have been hospitalized, and the majority of whom are not hospitalized any longer and doing very well. We do have people who have been hospitalized more recently, and obviously I can't comment on their individual status.
When the cases at Alder Bay on Monday and Tuesday's additional case were announced, you mentioned the incubation period of the virus. Based on what we know about that, are you expecting there to be more cases at the assisted living facility? And how will that impact how often you retest residents and staff?
So yes, the incubation is about 14 days, and so we tested initially. We are conducting another round of testing already, and we anticipate conducting at least one more round of testing during the incubation period. I think that's really important, and certainly the emergence of any new cases extends potentially that period of time that we'll be monitoring the situation there, because every new case is a potential new exposure. But I do want to mention to people that what we are likely just seeing is the playing out of the exposure that occurred. And we did anticipate at the outset that we would see some additional cases materialize. In these settings, it's very much like people living in a household together. And so it's very, there is contact by the nature of the fact that you live in a congregate setting, as careful as you may be. And so, yes, it's an important thing for us to be able to monitor closely and provide assistance to the facility where we can.
The ability to manage an outbreak in a facility like Alder Bay, or to prevent one, is one of the governor's key metrics used to judge when local jurisdictions can move further out of lockdown. Will the rate of spread of virus inside that facility amount to a referendum on our ability to manage reopening ourselves?
Well, I think that each of these settings we're going to have to just look at differently, but I do think our ability to manage these, to do the appropriate investigations, to be able to do the appropriate amount of testing so that we can identify new cases, and our ability to treat people who need to be treated in the sense of providing hospital care if it's needed. All of those things are measures of our ability to move forward. When we have one facility that has difficulty, that obviously is in many ways a much easier thing to manage than if you have multiple, as some areas have seen. And so it's one of the factors that we'll be looking at when we make decisions about moving forward, even if we have approval from the state to do so.
What factors will you use to determine whether we have successfully managed the Alder Bay incident or whether we have failed to do so?
I think we probably just spoke to that, but it's certainly, making sure going forward, I would say beyond Alder Bay, that, we're working really intensely with other facilities so that we have multiple skilled nursing facilities, we have multiple assisted living facilities. We're really reaching out to all of those facilities and have been doing so from our EOC to sort of make sure that they have all the appropriate equipment on site that they might need, that they're thinking of and planning about what to do when they have potential cases on site, and that they're thinking about all the prevention measures they can take to prevent cases on site. So I think those are all important measures of our success.
Has Humboldt County had access to serology testing? If so, is it limited, or can people schedule appointments for testing?
So serology testing is available through commercial labs, and there are some local practices that may submit specimens to those commercial labs, and people can look for that availability through their providers' offices. What I would tell you is that public health is not conducting serology testing. At some point, our Optum site may be able to offer that when it's really got good accessibility through the commercial labs. But I just want to emphasize to people again that right now serology or antibody testing is a really good public health tool. It's a good surveillance tool. But again, it is not a good tool for people to use to assess their individual health risks. Because we, again, do not know that a positive test means that you have immunity if you become exposed. And if you do have immunity, we don't know how long it lasts. And so we just want people to be really careful about that. Getting a positive test result does not mean that you are safe to move about and not worry about all of those measures we've put in place. I expect in the not too distant future we'll have a much better understanding of what the results mean, but right now we just don't know.
Thank you, Dr. Frankovich.
Thank you.